FreeBody family, welcome. Today I'm here with the lovely Miss Alicia Lee, and we're here in the FreeBody Clinic in Asheville, North Carolina. And the purpose of this channel is to help you, body workers, massage therapists, people who work with other people's bodies, to kind of understand pain, dysfunction, how things get out of whack with each other, and give you skills and tools that you can use to help your clients feel the best that they can feel. So today we're going to do some work in Alicia's hips. And so Alicia, I'm just going to ask you if you can tell us a little bit about your hips, just a kind of quick synopsis of some of your hip history.
Well, as a dancer, I definitely have had a lot of tension in them. They feel like, they don't want to open often. I have been told that one hip is higher at the chiropractor. It's just overuse, I think, and it just always needs some kind of relief.
Okay, so what I would like to do is I'm going to do a quick evaluation and just kind of see what I find if I find one hip is sitting higher than the other. And that's the part we're going to address. So most of the people who come into your treatment space have one hip that sits higher than the other. It's probably like one of the most common patterns I see in people's bodies is one hip being higher. And then often what follows is one shoulder is higher than the other, one side of the neck hurts, one side has sciatica, one side the hip is weak. Like it leads to, from that place in the center of the body at the pelvis, that part being off leads up and down the chains and wreaks havoc and causes a lot of problems. So having, starting many of your clients, no matter what they're here for, if they're coming to you for headaches, if they're coming to you for pelvic issues, if they're coming to you for back pain, hip pain, whatever it is, I recommend that you do a test. One hip, see if you can tell if one hip is higher than the other. If you can't, don't worry about it. Don't worry about it. If you can't, just see if you can tell, and I'll give you a way to do that in another video. See if you can tell. And then if you can't, just do both inner thighs and both outer hips and both low back, both sides of the low back. That's the best way. But what most therapists don't do is the inner thigh piece, and that is so helpful. So I'm going to do a quick evaluation with Alicia, and then I'm going to get her on the table, and I'm going to show you what I would do based on what I found. Now that Alicia is on the table, we can see that she has set herself up how so many people set themselves up on the table. So I'm going to help her to get in a more optimal position for this work. You can see that her butt is back here, which is in a good spot, but then her body kind of is diagonal toward the upper corner of the table. And this is natural. People want to curl in, right? So what I'm going to do is ask her to slide her body back along this back edge of the table, her butt and her shoulder. Now she's more lined up, and then the butt, no more. There we go. Now she's really more lined up with what is now the back edge of the table. And that gives me a little bit better access to the things that the areas that I need to work on today. So another piece is that I want to just keep this a little soft. So we have a soft angle here at the pelvis that opens up that front of the pelvis for the TFL access. But it doesn't, like if her knee is too much up like that, see how that closes that front kind of pocket off right there? So that's not going to give us the access we need. There we go. Now we've got this kind of just a softer angle. So that's good. She's supported on this good bolster. So remember I did that video on how to set up for side lying. We're going to drop a link in the description of that video because that's going to help you to get your client set up well. And then the other thing we want to check is, another thing almost everyone does is they roll that hip forward. Everyone's like, yeah, this is my favorite sleeping position. I'm going to curl and roll forward. So we're going to ask our clients to, especially for the beginning, to stack the hips one on top of the other. And then we just keep adjusting, make sure they're supported. Bottom leg is behind the bolster and not underneath it. That's really important. So remember, watch that video on how to set up side lying. And now I'm going to give my friend here the final pillow, which just kind of helps everything. We're going to give her, in my office, we call this the whoopee. And then she feels nice and cozy, and that also can help to keep her from rolling forward quite so much. So now we've got her nice and tucked in. How do you feel? So cozy. And so remember, I also said, oh, Alicia has a little bit of a left hip that sits high. So I want her to start on her high hip side. So she's lying here on my table on her left side. So I have access to this right outer hip and the left inner thigh. So remember in that first talk that I gave earlier in this video that the right hip, if the left hip is high, the right hip is low. And these muscles here are going to be short and pulling this right hip down. And then the muscles of the left inner thigh are going to be short and pulling that pelvis over to the left, pushing that left hip high. So of course we're going to do really good quadratus lumborum work in the low back. And we'll link in the description to that work, to a video on that work. But this really has to be done. This little combo of outer right hip and inner left thigh. And that helps to get the pelvis moving toward level. And inner thigh work is often missed. So don't skip it. Don't miss it. It's some of the most important work that you can ever do with your clients, partly because a lot of therapists don't do that work. And it really must be done. So in this position, I just start with a little soothing. If this hip is low, that means TFL is short, glute med is short, has a big pull on that pelvis. Glute min is short. Remember, pain referral patterns of glute min are radiating down the iliotibial band, could be in this outer shin, could be in the hamstring, could be in the calf. She could be having a deep ache in the buttocks. All of that could be happening on this side or the high hip side. It's really about imbalance. Glute med, glute min, if they're unhappy and full of trigger points, she's going to maybe experience some weakness in that hip, either side, the high or low hip side. So often the muscles that are crying out in pain are the long muscles. So often people start exactly in the wrong place in their work in massage. I see this all the time. If someone comes to me with hip symptoms, I'm going to start often with the inner thigh first. So this person often with the left hip high often has left glute min and left glute med symptoms, which again can be hip weakness, radiating pain down the iliotibial band. The short muscles are just kind of in there doing their thing. They're kind of happy about it. So we're going to just kind of soothe and soften up the sides of the iliotibial band. I'm not pushing real hard because that would hurt, right? Iliotibial band through here, vastus lateralis, it just hurts, right? So we don't want to do that. Okay. So we just want to kind of say hello, make nice. And then here's her hip up here. So to do this part of the work, I'm going to just kind of go through the sheet. I'm going to take some of this blanket away so that you can kind of see more clearly where I'm working, but I'm going to leave the sheet over her for privacy. So I'm going to pick up this blanket and I'm going to pull it back. Great. I'm just going to tuck it around her. I can pull this sheet back, but I don't have to. So you can choose how you do this work, either through the sheet or to her skin. I'm going to show you both. I'm going to show you that it's effective either way. But see, now we've got this beautiful access to this right hip, and we've done some soothing. She's more and more relaxed. She's been lying here a while, soothing along that iliotibial band. And now I want to find the ASIS point. So ASIS point, the very prominent point at the very front of the pelvis. Tensor fascia lata goes backward and attaches into the iliotibial band. So it's right here in this front corner pocket of the front side of the pelvis. So lateral anterior pelvis, right on the very front in this little corner pocket. So I have to kind of hook in and angle in this way to access that. I find that works best with my elbow. So I'm going to sink my elbow in right there. And then I'm going to shift my weight back. And is that a tender spot right there?
Yeah.
Yeah, she took a nice deep breath. Would you like less pressure? Is that too much pressure? Does that feel okay? So she's doing great. She's doing some nice deep breaths. Mm-hmm. So I'm just right at that TFL, right at the very front of the pelvis. And I have to kind of hook in right at the crease. Now, here's something about trigger point work that's so specific. You have to really angle at 90 degrees to the trigger point. So she might say, oh, that doesn't feel right. So I might lift my hand. I might bend my elbow more to give deeper pressure. I might just shift the angle very slightly and then sink back in and communicate. I've done this point tens of thousands of times, so I usually nail it pretty quickly. But if you're finding that you didn't find it right away like I did, of course, if you've not addressed this tissue before, then you're just going to kind of play with the angle, moving slowly. This muscle is very tender. I've never met anyone that was like, nothing. I feel nothing in the TFL. It's a really tender muscle. And how's that going, Alicia? Is that getting better? Does it feel a little easier now? Yeah, she's nodding. Yes, it is. Okay, great. I'm going to back out, so I'm going to lean my body forward to pull my elbow out of that spot. And I'm going to take this blanket one more layer back so that we can see. Let's see. She got her panties on. Good job. Great. Okay, so here is that ASIS. I can feel that bony prominence. Here's that soft crease. So you can even see a little redness where my elbow was going right in. See how I got to get right in there, okay? So now from that place, now we know the very top rim of the pelvis, greater trochanter of the femur. Here's that top of the iliotibial band. Here's that TFL where I just was. I'm going to go right behind it, and I'm going to sink real close. I'm going to circle the dragon. I'm going to circle around this greater trochanter of the femur so that I can get into glute min. So that's what we're doing next. Here's greater trochanter of the femur. Here's the top of the pelvis. Right through that, you can often palpate the top. I can feel the thickness of her iliotibial band right there, just as I would expect it to be. And then it's tender in there. So I'm going to get my elbow right next to that greater trochanter. And watch what I do. I'm going to have it a soft elbow. I kind of wiggle in, find a soft place to sink my elbow. And then I just sink straight down toward the floor. And let me know, is it tender in there at all? Right there, great. I'm always sinking with trigger point work. I'm never pushing. I don't want to push into someone's body. I want to sink into someone's body because I want their body to let me know when it's enough pressure. If I'm pushing, I never receive that message. Then it always feels like resistance because if you're pushing, their body is going to push back. So I work with my table. You can see in the body mechanics portion of this, you can see I always work with my table low. My back is straight. My legs are supporting me. I have my other hand is supporting me on the table. And I just wait. All I'm doing is waiting. I'm allowing her body and the tension to soften and unwind. I'm just here holding space for that. I'm just going, oh, here's some tension. Here's a trigger point. You can breathe and let it go. She's doing an amazing job with her breathing. She's relaxing her body. So really feeling your body on the table. Feel as you exhale, your whole body can sink a little more heavily into the table. Beautiful job. Great. And then after a couple of minutes, I'm going to move on, right? Or I'm going to ask, do you want more pressure? Do you want more pressure? Yep. Okay, great. So now when I want more pressure, all I have to do is bend my elbow more. You tell me when. That's it. Great. Notice I didn't push. I didn't even sink more deeply. I didn't move the rest of my body. All I did was lift my hand. Lifting the hand drives the elbow point deeper into the tissue. It's effortless, deep work in her glute min. She's feeling it very strongly. She's breathing deeply, doing a great job relaxing her whole body. And we're going to take just one more breath here. And then to back out, I drop my hand, and that pulls my elbow out of that spot. And then I'm going to do some soothing. Great job. Great job. Great. And you can see there's a little bit of red there where I just was. So where we started was we came in at this angle into TFL. Then we went straight down right above the greater trochanter. We have to be in this very lower portion of the side of the pelvis here because that's where glute min lives. So what I do is I find that, again, for that first point, I can feel the greater trochanter, the top of the hip bone with my elbow, and I sink right next to it. So I was right next to that. Now I'm going to come up a little bit toward that top rim of the pelvis, just about an inch or so, and I'm going to sink into that spot and see how that is. So here we go. I'm going through the top of the iliotibial band. If I slide my elbow forward and back, I feel the thickness of the iliotibial band, and then I'm going to go straight down through it, and you're going to let me know when it's enough pressure. There. So she started nodding, going, yeah, that's it. And so we'll drop the pain referral pattern picture in here. You can see where the glute min holds some of its points. And so I just want to say again, I'm releasing her right hip to affect the symptoms on her left hip. She might be having some trigger point pain referral patterns on the right side. Most of the time, it's going to be on the high hip side is where she has her glute min and glute med and TFL pain referral patterns. But we have to always release the stuff that's short first and address the trigger points in the pulled long muscles last. So we're going to take one more breath here. And then we're going to check just one more spot. I'm going to come out and I feel with my elbow, there's that greater trochanter. I'm going to come around just to the back of it a little bit. This is going to be the last point that we're going to do here. I soften my elbow bend. I sink my body weight. So my body weight just sinks in. And then I'm going to bend my elbow a little more. And I'm also going to kind of push it toward that greater trochanter of the femur. So I'm kind of trapping it. So it's a little bit, I'm going to redo that. I sink down, bend the elbow for depth, and then watch my right hand. It comes in toward my midline, which pushes the elbow out and traps that trigger point. Her breath immediately got deeper. It got stronger. She's like, okay, yeah, Kat, that is special. That is an exquisite point right there. And let her take a couple more breaths. Do you want more or less pressure here, Alicia? No, just good. Yeah. Mm-hmm. Beautiful. Take one more breath here. It feels to me like it's softening a bit. Are you having that experience also? Yeah, great. Okay. So then to come out, I'm going to take my right hand toward the right, which is going to pull my elbow out of that angle, and drop my hand. That's going to pull my elbow out of the depth. And then I'm going to lift my body up and out. And then I'm going to soothe. And I'm just going to take that sheet right over, do some soothing. Mm-hmm. Great. So I also like to do a little bit of soothing along that iliotibial band. And just as I'm as I'm working here, I always want to be mindful. Sometimes people don't have underpants on. Sometimes they are feeling a little more shy. That's fine. We always just want to keep slowly gathering the blanket and the sheet around and making sure that our client feels tucked in and covered. You could even tuck this into the edge of the panties there so you have access to this iliotibial band and the side of the hip. And then you just do gentle. If I get right on that and push really hard, she's going to cry and she won't come back. And that is so true. And so now I'm just doing a little bit of the tracing of the iliotibial band. This is one of the techniques I teach in the awesome hip work and the awesome hip work. It's just tracing this iliotibial band. And it's a little chunky as our fascia, gets a little sticky in some areas. You can feel it gets a little chunky through there. Whoops, Jinx. She's really relaxed. That's really good. That's really good. All right. And just that little bit of soothing is always nice. I've worked with a lot of trigger point teachers that didn't use oil. And honestly, I think that's a mistake. I think that it's really important to do this soothing because trigger point stuff is stressful. It's intense. And it's like the most tender parts of someone's body. And then there's now, the more we have understanding of fascia, we know that in the fascia, there are those soft touch, sensual touch, sensory receptors that when they get stimulated by this soft, lighter touch, it generates a sense of well-being through the whole person. So always, if you're doing deep, kind of specific work, soothe it out. Soothe it out. So now we've done some nice work in TFO and glute min in this outer right hip. This is the low hip side. We always want to start our outer hip work on the low hip side. Now we're going to move into the inner thigh work of the high hip side. So we're going to recover. And we're going to take this. And then I'm just going to give her this blanket in the top of her body so that she feels nice and cozy and tucked in. And I'm always checking, do you feel comfortable? Does that feel good to you? Good. I want my clients to feel kind of that I'm mothering them a little bit, right? Because I want to really show up with lots of care. So now, in this position, we have great access to the inner thigh. And so I'm going to take this table and move it up just a little bit. Great. So what is this inner thigh work? If you don't do really specific trigger point work, that's totally fine. Just some nice compression through here is going to make a world of difference. I feel like the adductors, the inner thighs are really not appreciated enough, and their role in the health of the hips and the low back, it's just not appreciated enough. So I'm going to start with some nice soothing work, kind of saying, here I come. I'm going to give you some attention in here in this inner thigh. And so what do we have here, just anatomically speaking? Coming from the pes anserine below the knee, we have gracilis, and that's a thick tendon. It's literally like the inseam of the pants, kind of coming right here. It's always a tender spot right in the middle. She was like, yep. And then just on top of that, or toward the anterior, toward the front of the thigh, we have also coming from the pes anserine, our little sartorius friend that flanks the quads and then goes up to the ASIS, that front point of the pelvis. Notice my body mechanics. I am using my whole body and my pelvis to guide and drive my work, never just my arms and my hands. That's why I can, over 30 years of practice, I can still do it. And just lots of warming. And then toward the groin, toward the top, we have adductor brevis point, adductor longus point, kind of right along around that gracilis. And then this whole section behind it is adductor magnus. Now, adductor magnus is a really, really underappreciated muscle. Adductor magnus has the strongest pull of all the adductor muscles. The strongest pull of all the adductor muscles. So it needs some attention. It is a big piece of the one hip higher than the other puzzle. So I'm going to glide along. Notice my angle, right? I went to the top. That's gracilis and adductors, brevis and longus. And then I go behind it I want to be 90 degrees always to the tissue. So notice my body mechanics, my knees drop and bend. And now my angle is more diagonal toward the back of the thigh. Can you feel that? It's nice, right? I'm just going to hold a steady compression. Back here behind the palm of my hand is the hamstrings. In front of the palm of my hand is gracilis, adductor, longus, and brevis. Where I am at this sort of midpoint in between those two is adductor longus and magnus, and it fills the whole inside of the thigh. If this is all you do is hold this steady compression for a minute or two, your clients will love it, first of all, and you'll have a big impact on their hips and their low back. So I'm just holding steady compression, and then I'm going to back out. So I just back my body out a little bit. And then I'm going to hold steady compression right on top, going straight down center from front to back of the thigh. Right here, we've got the thickness of gracilis, and then deep to it, adductor longus, adductor brevis. We can get real specific with our thumbs, or we can use a soft fist and use the knuckles, or we could do it this angle, or we could get an elbow in there and go straight down, or we can just hold a steady, broad compression in this area with two hands. So I'm going to do that right now. And just take a nice deep breath there. A reminder that steady compression is deeply soothing to the nervous system. So if you're doing a lot of fast movement, your client will have a harder time relaxing. So I'm not in here going, what's going on? What's going on? I'm going to go down here. I'm going to do this. Right? Like that's stressful to the nervous system that's receiving that. You'll notice my work tends to be long and slow for a reason. It's very soothing, and I don't want their nervous system to be freaking out, right? So we just did that nice steady compression up here, kind of through gracilis into adductor longus and brevis. Now I want to get back into that adductor magnus a little more specifically. So I like to line my fingertips up, and I can kind of feel just at like almost skin level, just a tiny bit below skin level. I can find there's a little shelf I drop off right here. That is adductor magnus. There it is. Hi, adductor magnus. And so I'm going to angle in. Remember, I got to be 90 degrees, so I'm going to angle in this way. And I'm just going to sink my body forward. And she's taking some deep breaths. This feels really a little exciting and also really therapeutic. And do you want more or less pressure, Alicia? Nope, it's great, it's good. And the reason it's good, the reason I nail the pressure every time is because I move my body to guide my work, and I'm not just pushing with hands. So if she wanted more pressure, I would lean forward. And if she wanted less pressure, I could just bend my back knee to back out a little bit. And if she wanted more pressure, then I could lift my back heel, and that's going to drive my fingers more deeply in. How's that? Okay? And so this isn't like I'm not even going really specifically into all the trigger points. This one here, this one here, this one here. Just that deep, steady compression, lots of soothing in the inner thighs, you can get so far. You just can help your clients so much. Great. Last exhale, you're going to really feel that whole outer left thigh sinking heavy into the table. Beautiful job, beautiful. And then I'm going to drop that heel. That's going to start my pressure backing out, and then I'm going to back my body back. There we go. And that's what gets those fingers out. Now, if lining up and using your fingertips doesn't seem good to you, you could use fists. I could have used my knuckles in this way, right? I could have just used the heel of my hand in this way, but I really like that fingertip thing. It's a little more specific than the heel of the hand. And then we, of course, want to do just some nice soothing, right? All right. So if you don't feel adept at finding very specific trigger points in these areas, you don't have to. Just follow what I just did. So I'm going to go through that all real quickly again. So I'm going to pull this out. And we're going to adjust this blanket a little bit. All right. So we got her set up side lying. Remember to look for the link in the description of how to set your client up side lying. And then we started with some soothing. This is the low hip here on top. Her left hip likes to be high from an evaluation that I did in her body. So we see her left hip a little high. And then now we see this right hip is a little low. So I always want to start with that one here. I hit that TFL right in the corner, and I hook my elbow in and lean my body back to get that point. Then I find that greater trochanter of the femur. I palpate, flat finger palpate, feel that like apex of the hip joint right there, greater trochanter. Top rim of the pelvis, the ilium is right here. I want to get my elbow right where it starts to go off. Like there's bone, there's soft tissue. I want to get right in that soft tissue point. I sink in. Then I come up and I just go about an inch toward that top of the ilium, still going through the iliotibial band, and I sink in. Then I come back to around that first spot, come backwards a little bit. I sink in, and then I angle into the greater trochanter. And I can do that all the way around. I can just keep trapping that tissue into the greater trochanter, the femur, the top, that bony prominence that I could feel. If my angle is different, if my angle is this way, that's not getting it at all. Feels completely different, doesn't it? Yeah, she's like, yeah, totally. Right, it's all about angle, this work. So if I turn my hand to the left, my elbow's going to go to the right. It's going to trap that tissue into the greater trochanter of the femur. And of course, I can do some nice, like, ooh, piriformis. Hi, piriformis. Little glute med, little glute max at the bottom. Lots of soothing. I'm just saying hello to everything. Then I did some nice soothing with oil through that side. Then we came to the lower part, the inner thigh of the left leg. And frankly, I might often, when someone has one hip high, I don't do this on the other side, not the first session. I want to just get things moving in a direction of leveling the pelvis. So this might be, then I might just have her go face down and work her quadratus lumborum, which is the next step in this treatment. And so then I'm going to tuck her in, make sure she's cozy, and make sure that I have access. Remember, tuck into the bolster, not up to their special parts. Tuck to the bolster, not their body. And then even if you don't know what else to do, not a lot of pressure here, more pressure here up by the pelvis, and sink in, just steady compression. If you just did that, that would be incredibly effective treatment. And then we'd come right behind that, drop in, angle a little bit more. Now we're in adductor magnus. If you just did this, how's that feel? It's so good. Everyone says that. Everyone's like, I never knew, no one's ever touched me there, and I didn't realize how much it needed to be touched. Truly, you'll be the most popular therapist in your town if you get really adept at this work, because it's play with it for real. Like, get your client set up side lying, and then work a little inner thigh and outer hip and move slowly, sink slowly. You want to, especially areas like the inner thighs, a lot of sensitivity in here, a lot of trigger points that have never been treated. So nobody wants you to just start jamming your fingers and thumbs and elbows in there real fast. Always slow and respectful. You're asking permission every step of the way. We're big on consent here. Okay, so you're going to pull this out, bring this back, and then that is like a major part of your treating your clients with one hip high.